Hi, this is Marla Philllips, Director of Xavier Health. Thank you for joining me. There is so much buzz going on in the industry about artificial intelligence that I wanted to be sure you know how it can be used and how you can get your company involved, or if you're already involved, how you can be even more involved. We've launched the Center for Artificial Intelligence with industry and FDA to develop free open access to solutions any company can implement, even without AI. So let me share what's going on. I'd like to start off with some examples of AI in the world that you're already familiar with. And so, for example, spell check. This is an example of where the computer or the machine, when we talk about machine learning, can offer suggestions for misspelled words by evaluating a series of possibilities using nearby letters or common words using the letters you typed, even if they were incorrectly typed. Obviously, we're familiar with website searches, and what's amazing is these search engines have built the capability of searching before you finish typing. So what that means is you start typing a letter or two letters, and it's already predicting what it thinks you want to search using clues from every letter you type. I'm always amazed. I type the letter H, and it pops up this huge, long sentence of what I could possibly be thinking of, and it's amazing how often it's right. So you only have to start typing part of a word to get the entire phrase to pop up. So it's pretty amazing. And then you might be familiar with the fact that Watson, IBM's Watson, beat Jeopardy champion. And it had to learn colloquial speech, inferences, humor, how to respond in a question from a given answer, and all the things that go into human language that aren't formal written language. And it did. So how does the machine do this, and how does it learn? However, you might be thinking, okay, so what? I'm guessing you're not trying to win Jeopardy at work. So how can you use AI in your organization? And so here are some examples of how artificial intelligence is being used already in the pharma and device industries. So for example, it's being used to predict clinical endpoints. So clinical trials can be stopped if early failure signals can be identified, or can financially be supported to continue if it looks like success is likely. And of course, this is critical because, as we all know in this industry, clinical trials are extremely expensive. But probably more importantly is the fact that you've got patients enrolled in your clinical trial, and if you're seeing that your trial is not as effective or maybe even harmful, you need to make sure that the patients are aware, or possibly even have the trial stopped before anyone's harmed. It's also being used as a diagnostic tool to detect early signs of illnesses such as dementia and depression. So with dementia, they're looking at speech patterns that even the closest relative hasn't picked up on, and AI is able to pick up on this and recognize signs of dementia. It's also looking at depression, and again, speech patterns where even the closest person, you're just so close you can't even see the signs that the person is depressed or maybe even suicidal. So the power of AI to pick up on what we as humans aren't noticing is fantastic. It's also being used to identify gene targets, for example. So what genes can we target for R&D focus to develop the next greatest product to help that therapeutic area? And you might be familiar with big data, or at least the term of big data. And you can imagine that it's pulling in lots of data from all different kinds of sources to assimilate this information and bring it together in a way that humans can identify trends and signals that it's pointing to. So these are ways, just some examples of how AI is already being used in pharma and device. But now imagine if we could go beyond that. Imagine if we could bring AI into quality, regulatory, and supply chain. And that's exactly what we've set out to do through the Xavier Center for Artificial Intelligence. And so I'm going to share with you a couple of examples that we're going to explore. And one of them is I'm referring to as continuous product quality assurance. And imagine that you could have this continuous product quality assurance instead of annual audits or audits of some type of frequency that assess a very, very small portion of your documents. And I put in the number myself of 2%. It's just such a small fraction of documents that you can actually look at and assess during an audit. So now compare that with the fact that today, when you look at those documents, you're basically looking at something that has already happened, so it's after the fact. If you look at these documents through artificial intelligence, it becomes predictive. You can identify things that are happening that could lead towards an event or a failure. So it becomes predictive. And then, as I mentioned, instead of an annual audit or every quarter or however often you do an audit, it's periodic at best. And then on AI's side, you can have this going on continuously. It can be scanning all of the information all the time. And then importantly, instead of that statistical sampling, whether it's 2% of the documents or whatever the percentage is, you're on the AI side, you're looking at the totality of documents, and again, on a continuous basis. So the power could be amazing, and the information that we could have in our hands. So basically, you can scan all of your documents constantly to identify trends you didn't even know existed. And importantly, you can identify signals that lead to GMP violations before they happen, but importantly, failures that could affect product quality and risk to your patients. So now the second example that we want to explore through the center is continuous operations predictability. So if you can imagine all different kinds of variables that you can enter into the artificial intelligence program. So you have current internal variables that you're already looking at, but then there might also be some relevant internal variables that you didn't quite think were related, but and then it also, maybe you did know they were related, but we don't have the human bandwidth to be able to look at all this information. So you can start folding it into what AI can assess. It can also look at available external variables. What's interesting is, imagine if you brought in financial information about your company or a competitor's company or a supplier, and you could see that maybe when there's financial downturn in a company, they're more likely to have risk of recall or risk of failures because they don't have the money now to invest in the resources or the training or keeping the equipment maintained or whatever it is that would normally be done. So you could possibly fold in some financial information that could give you a signal of, hey, we've got to watch out, something's going on here. That's just one example, but there's lots of external information out there that you could fold in. What about unavailable external variables? So that sounds a little odd, but what about, we talk often about the FDA has a lot of information that they could share publicly, but having it in a database or format that people outside of the FDA could access is not currently available. So maybe we could work together to identify some critical information that is possible to share publicly, but just isn't at this time. And then being able to look at this across the total product life cycle. So as you're making current decisions on product you're about to release, you pull in historical information about incoming materials or product on the market, and you just have all of this coming together. And what's neat then is the intersection gives you that robust prediction. So when you can bring all this information together, you have more robust information where you can make better decisions prior to pressing that button to release the product out to the market. But I do want to warn you, of course, that we have to be aware that garbage in is garbage out. So you have to look at this information that you're feeding in and make sure that it is relevant, it is good, it is solid, it is reliable. So as I mentioned, we have the Center for Artificial Intelligence, and the way we want to address the examples that I just shared with you is through our summit. And this will be an annual summit that we're starting this August 24th and 25th. And part of what we want to do is build the program so that you leave with an understanding of how to put AI into action in your company. So for example, if you really are not familiar with AI at all, we talk about how does natural language processing work. So the computer's looking at text instead of just numbers. We talk about machine learning. How does that work? There's going to be a live demo to show you how it works. But then we build into having working teams established at the conference so that we can develop industry teams that will work on these solutions throughout the year. And importantly, they'll present progress at our FDA co-sponsored PharmaLink conference in March, and then the output at next year's AI Summit. So these are actual working teams with very, very structured goals that they want to achieve and a process for them to follow. They'll be supported by a mentor from our core team, as well as an AI expert, and have AI experts on the team. So this is an opportunity for you to join in and see how we're developing something that the entire industry can use, including, of course, at your own company. At the summit, I do want to also share that FDA is going to be providing their vision for how industry and regulators can collaborate to use artificial intelligence. And Bakul Patel from CDRH was just assigned the task of starting up the digital health unit that reports directly into Jeff Shuren, who's the head of the CDRH branch. And in that digital health unit, he has artificial intelligence as part of one of his strategic priorities. So he'll share what he's envisioning for that. And then, as you can imagine, this is really a very nascent starting point for us as an industry where we can now build this together and shape the future together. So I mentioned the core team. I want to share with you our core team members, and I'm not going to read the names because you can see them here, but we have quite a few amazing experts on this team that are just passionate about what we're doing and the potential that we have. And so you can see Bakul is actually on our team, as well as we have solution providers and experts and people working, for example, like at the Children's Hospital, where they're implementing these solutions already in diagnostic format. So a great group of people who are supporting all the work that we're doing. So, but you might be thinking, I don't think we're ready for AI in my company. Well, let me show you why you are and how you can benefit right away. So as I mentioned, when we have these working teams put together, there's going to be output that they're going to be coming up with. And I want to share with you how you can benefit from that right now, even if you're not implementing AI. So the goal is also that the work that the teams are developing will allow you to start off by crawling and then walking and then running. Or if you're already walking, you can take off running. Or if you're running, start sprinting. So it really covers the entire continuum. But in order to have a viable solution, no matter what we're working on, these teams will have to harmonize definitions of terms across systems. So this is something that you can use right away for your company to start harmonizing how you're looking at your information that you have across the systems, even as humans, so not even with AI. They're going to be looking at how to clean up the management of data. So, for example, if you're looking at something on a per product basis and in one database, but in another database you're looking at it by lot, and so you can't really compare apples to apples, or how you're storing the information or its searchability. Really looking at how we can clean this up so then it can be incorporated into AI. So again, even if you're not going to use AI, that's an important thing to do. So as humans, we can simplify it a lot better and be able to look at this information ourselves. So the third point is how to improve electronic searchability of the data and access to the data. So again, this is critical to support the current decisions you're making regarding your product quality. You're ready to hit that button to release it to the market, but there's information you have somewhere in your company, somewhere in a silo, or somewhere in a database, often some functional group that only certain people have the password to. So I think you know what I'm talking about. Most companies have examples of that. So how can we improve that accessibility, and so you have more robust information at your fingertips? So now the other thing that the teams are going to be looking at is identifying interrelationships of data within and across systems, as well as across internal and external sources. So this mapping of the interrelationships can be used for human decisions right away. Again, if we point out, gosh, did you know that when this occurs, it's connected to the information in that system over there, you can start using that in your current decisions. So I want to share with you just a few more examples of the output and how you can benefit. So we need to identify the cause and effect relationships between data and failures to detect early signals, and that's how you can become predictive. But again, I want to point out that the machine learns, and so it's going to be learning the whole if-then sequence, and it'll notice that when things happen, it does or doesn't have the effect that we thought it did, and then it files that in its database of knowledge, and it learns from that, and it applies those new rules to information it's assessing going forward. Just like the human does. I mean, we do that all the time, constantly. So it's amazing how similar it is. So this is powerful to understand even without AI. So again, you can use this right away. So we're still in the crawl phase. You don't even have to be using AI to do this. But now 6 and 7 really do get into factors of if you are ready to implement AI or if you have already. So we want to identify all the relevant data and information needed for AI programming. What does a data scientist need in order to program whatever it is you're looking at in a way that will be useful to the end user? So data scientists within your company, or if you don't have data scientists, so now you're getting ready to walk, you could use external supplier services to help you implement what you're trying to do with AI from this working team output. And then the last point that I want to stress is that we're going to be outlining the steps needed for data governance, procedural changes that are made, human training. How do you basically set up your systems and your culture for AI? Believe it or not, this is still helpful without AI. So you want to make sure that you understand who's governing your data, who has access, why do they have access, what's happening to it, how's it managed, how's it maintained, is it accurate, all those kinds of things. So again, even number 7 applies if you're not planning on implementing AI. So I hope you can see from these examples that what we're looking at is not so futuristic and you have to be high tech and you have to have millions of dollars to even think about coming and getting something out of this summit or out of the work we're doing through the center. So I really hope you can join us. But you might be thinking, okay, we don't have time, money, or resources to do anything. But I do want to point out that we're developing solutions for that crawl, walk, and run. So there is somewhere on that continuum that you can find where you can move your organization forward in a way that is comfortable and appropriate for where you are at this point in time. But I also want to point out that you're not looking at necessarily adding resources. It could be shifting your resources from managing the failures to increasing the data robustness. But however, I do want to point out that money is needed eventually. You do need to build the AI capability, and so that could come internally if you have data scientists or people who are capable of that, or through outside services. Now, where does the money come from? It can come from implementing the solutions that we talked about, the 7 points, the solutions you can develop without AI so that you can start decreasing or reducing your failures and now use that money to invest in this opportunity to take your company even further with AI capability becoming predictive. The other option is if your company is fortunate enough where you can invest in building these capabilities, knowing that your return on investment will cover the expenses. That's certainly another option. So what I basically want to stress is don't be left behind. This is really the new wave of the future. This is where companies are going. The power is here. When we talk about metrics, it's almost antiquated. Yes, you do need to keep tracking metrics, but the decisions you're making from those can be so biased and really reactive. So artificial intelligence really helps our industries, the pharma industry, the device industry, and FDA as well, to move forward and get to that total quality ownership and the assurance of our product quality throughout the total product life cycle and even into your supply chain. So I hope you can join us. If you have any questions, though, about the summit or anything you heard today, feel free to give me a call or send me an email, and I look forward to hearing from you. Thank you very much.